Hi, my name is Mariana, and I work for the Brazilian Ministry of Health, managing the team responsible for HIV, syphilis, viral hepatitis, and other STI diagnoses. I'm going to present the results of the pilot project for free HIV self-test distribution in public health in Brazil. Brazil is a large country with continental dimensions and a population of 210 million people living in different realities between the 5 regions. We have an epidemic concentrated among key population, and it's increasing among young people. Here in this figure, you can see some prevalences in Brazil and our progress towards 1990 targets. Since 2012, we have been putting efforts on expanding rapid testing to primary care and training health professionals to perform rapid testing. This led to an increase in the first bar of the cascade from 69% by 2012 to 85% by 2018. Since innovative strategies are fundamental to increase access to testing, in December 2018, the Ministry of Health started a pilot strategy for free distribution of HIV self-tests aiming to reach undiagnosed people. The pilot focused on key and priority population and was carried out in 14 cities using peer distribution and distribution outside services as main strategies. Our strategies consisted in delivering up to 6 HIV self-tests in 3 situations. First one, for PrEP users to give to peers or sexual partners, since people in PrEP are at high risk and have a potentially high-risk network as well. Our second strategy consists on distribution at places of sociability of key and priority population by health teams and NGOs. And our last strategy is the distribution for people at high risk tested in health services for secondary distribution to peers or sexual partners they think can benefit from this technology. Here we can see some pictures of distribution in health services as picture 1 and picture 7, and in places of sociability of key population as picture 2, 5, and 6. You also can see promotional action in important events as Gay Parade in São Paulo and Carnival in Rio, and in a newspaper in Salvador. For information and communication, we developed a dedicated self-test website with information about HIV self-testing, where to obtain a self-test for free in each city, information on how to perform the self-test, including a video with instructions for use, and what to do in case of a positive result. We also have a section with the main questions and answers, a questionnaire to evaluate users' experience with HIV self-test, and promotional material. Lastly, there's a customer service that works 24 hours a day. For the analysis, we collected the distribution data through an anonymous form filled upon test delivery and then inserted in a monitoring system with questions regarding demographics, sexual behavior, previous testing, and the number of tests taken. Here are the main results. By December 31, 2019, we distributed 51,906 HIV self-tests in public health, and we have 16,364 forms filled. Of the people who filled the forms, 22% were between 18 and 24 years old, and 21% between 25 and 29 years old, which led to a total of 43% of the people who took a self-test being young people between 18 and 29 years old. Among those not in PrEP, 20% have never been tested before. This percentage is even higher in young people between 18 and 24 years old, reaching 32%. 14% has last tested for HIV over 2 years before, and only 37% has been tested less than 6 months ago. Black people and indigenous, both priority populations in Brazil, accounted for 43% and 1% of completed forms. Regarding gender identity, gay and other MSM accounted for 54% of completed forms and trans people accounted for 40%. An interesting data is that people in PrEP took an average of 3.3 self-tests to peers and partners, while other people took an average of 2.4. Here are some conclusions and next steps. Preliminary data suggests that strategies is reaching the target population for HIV self-tests, especially young people and first-time testers. People in PrEP are potential secondary distributors. These results encourage expansion for other states and cities in 2020. And innovative efforts to reach trans people are of special interest and should be increased. As additional information, in 2020, other cities became part of the pilot and some additional strategies were incorporated during the COVID-19 pandemic, aiming to maintain the HIV testing offered to population at increased risk during this exceptional period of social distancing recommendation. By the end of May 2020, Brazil had distributed approximately 41,000 HIV self-tests. I'd like to thank the professionals from the cities and states participating in this pilot, who did a wonderful job to implement this new technology in their territories. Without their efforts, none of this would be possible. Here are my contacts. Please feel free to contact me for additional information.